So hello to everybody that's joining us this evening. Um, Again, apologies for the slightly false start there. So welcome to the live Q&A hosted by the Cleft, Lip and Palate Association on the topic of CRANE. That is the Cleft Registry and Audit Network, open to everybody in the CLAPA community. Thank you to our funders, the National Lottery, Community Fund and Smile Train for enabling this event to happen. So my name is Antonia Sinclair. I'm the Community Engagement Coordinator here at CLAPA. I've been with CLAPA for about 2.5 years and learning so much about Cleft. I also have a personal connection to Cleft in that my mum was born with a cleft palate as part of a syndrome. And so I'm always eager to learn more and more. So I'm really looking forward to this evening and learning more about CRANE as well. So this evening we are joined by Sophie Butterworth and Kate Fitzsimmons. Thank you so much for being here. They're both from CRANE and they will be presenting today and answering all your questions. Sophie and Kate, would you be happy to introduce yourselves, please? Should we start with Sophie?
Sure. Yeah. So I work with the Cleft Lip and Palate team in Newcastle as a member of the surgical team. And I currently work with CRANE 3 days a week as a research fellow.
Hi, and I'm Kate. I am a senior research fellow at the Royal College of Surgeons, and I've been with the CRANE project team since 2011.
Lovely. Thank you so much for joining us. And thank you as well to everybody who has submitted a question in advance. We've got some really interesting questions to be looking at a bit later on in the evening. Also, if you do have a question whilst watching, please do pop it in the comments and someone from CLAPA will either respond directly to you or pass it on to us and we will try, well, Sophie and Kate will try their best to answer your questions later. If there are any questions that we don't get around to answering, then we will try and get back to you in the chat feature after the event. Right then, so we'd better get on with the presentation. Sophie's just going to share her screen for us, so I'll let you get that one set up, and then we will hand over to Sophie.
Let's hope we don't have the same issues as before.
Lovely.
Is that working okay?
Yeah, I can see that. And hopefully everyone on Facebook can see that. Excellent. Great. Right, over to you, Sophie.
Lovely, thanks. So as Antonia already suggested, CRANE is an acronym. It stands for the Cleft Registry and Audit Network, and we have a large database of children born with a cleft in the UK. We've got two main jobs, if you like. One is to provide a register of all children born alive with a cleft in the UK. That's really important because it allows us to plan and commission cleft services. The second part of CRANE is to audit clinical outcomes, and we do that at several different time points. So at birth, age 1, age 5, and currently up to age 10. We have oversight from the Cleft Development Group, so every decision that's made within that group, whether that's to add a new data item or to amend existing data items, that comes from patients and parents, clinicians or commissioners within that group. And we're currently funded by the respective NHS groups within each country. So there are actually 7 members of the team, which sounds like a lot, but when you add up all the part-time nature of work that we do, it only actually comes to less than 2 full-time equivalent members of staff working on CRANE. But we are lucky in that we have a lot of different members inputting both clinically and from academic backgrounds, and that works really well to produce a good database. We have all services now within the UK submitting data to CRANE, and that's been a little bit different over the years. So when CRANE first started in 2000, it was just data from England and Wales that was submitted. Northern Ireland was then added, and most recently Scotland in 2023. And the development of CRANE has been an ongoing process. So it's continually developing all the time to try and improve, to add additional kind of linkage to outside data sets to try and improve the data that we hold, and to also ensure that we comply with things like GDPR and processes that have come in throughout the years that have meant we've got to adjust and change. So just in terms of those important legal bits of information, we currently hold a Section 251 approval, which allows us to collect a minimum amount of registration data, and that's from England, Wales and Northern Ireland. We can't currently collect that registration for data for Scotland unless families give us explicit consent, and that's nothing to do with the patients or families. That's due to the legal structure within Scotland. Consent is required for us to input any outcome data on the Crane database other than that registration data. And we're extremely fortunate that within the UK, we have really high consent rates, which are almost 80%. So just to explain the registry data that we collect, so that includes these bullet points, so year of birth, hospital number and Cleft service. And those 3 bits of information are really important for us to count the number of children born with a cleft in the UK. The hospital number helps us identify number of children and avoid duplicate entries. And then the Cleft service helps us to split those children into the regions that they will be having cleft care within. We can also tell the cleft type that a child was born with, and if sex or ethnicity influences the cleft type. We can also tell important information about when a diagnosis was detected, when a cleft was detected, sorry, and hopefully that's as early as possible so that contact can be made by the cleft team. And we know that's really important to patients and families. So the purpose of the registration data, as we've said, if we know an accurate number of children born with a cleft each year, then we can plan and commission cleft services appropriately. We can ensure that the children are being seen at the appropriate time and that all children have equal access to cleft services. And that data has to be presented quarterly to the quality and nursing team in NHS England and NHS Improvement. And it's also information that we publish in our annual report and patient version of that report. So this is just a glimpse of how we publish that data. These are screenshots taken from our patient version of the report. So you can see that between the 1st of January 2000 and the 31st of December 2022, we had 23,606 children registered on the Crane database, which makes the UK database probably the biggest cleft database in the world. There are large databases from charitable organisations like have the extent of data that we have in terms of outcome data and long-term follow-up at this stage. So we actually have a fantastic resource. We also give a breakdown of the number of children born each year that you can see there. And then these are just a couple of the other images. So the breakdown of the number of children that were male or female. So 57% were male, 43% were female. And that breakdown does differ by cleft type, and that is contained within the full version of the report if you're interested in seeing that. We can also see that 82% of children were referred to by maternity units to a cleft team within 24 hours of the child being born, which is fantastic. And 94% were then contacted by the specialist nurse, usually within 24 hours of that referral. We also review the timing of diagnosis from that registration data, and around 3/4 of children have their condition spotted either before or at birth, which has improved over the years. And that little bar chart at the side, hopefully people will be familiar with those acronyms, but if not, CP is cleft palate, CL is cleft lip, UCLP unilateral cleft lip and palate, BCLP, bilateral cleft lip and palate, and then submucous cleft palate is the last one. And to some extent, we kind of understand it's more difficult to see some children with to diagnose children with a cleft palate, especially if it's a very small cleft palate or a submucous cleft palate, and that explains those figures to some extent. The children with cleft lip, we have a slightly different target for that because we're hoping now that they will be picked up on antenatal diagnosis. So that doesn't mean people are necessarily being missed at birth. That means some children are not being detected on the antenatal diagnosis. And this, I think, is a really nice illustration that Catherine de Blackham gave us permission to use. She's a cleft consultant in Ireland. So we've put these little images into a nice format in response to our CLAPA feedback from last year. So you can see the little nose. This is kind of looking up into the mouth as though the face is upwards. You can see the nose at the top, then the lip, and then the little ridge is the gum, and then the hard palate with a little line, and the uvula right at the back is the dangly bit when you say "ah." So we can see that on that cleft lip image, that child has a normal palate, and you can see that 25% of children, so a quarter roughly, were born with a cleft of the lip only. You can see that 42% had a cleft palate, and those little images just show little dotted line, and that was around a third of patients, and then a larger gap in the soft and hard palate in around two-thirds of patients. Children born with a unilateral cleft lip and palate made up 21%, and a bilateral cleft lip and palate 9%, and then submucous cleft palate only 2% and 1% respectively. So for those families that have completed a consent form, you'll probably recognise the picture from this information leaflet. We've included the web link there just in case there is anyone watching who hasn't consented or aren't aware they've consented. And we've put the numbers of parents we've received consent from for up until the 2023 birth year. So 79%, so almost 80% of parents consent to us collecting the audit data, which is amazing. Only 2% kind of explicitly don't consent, and the other 19%, it's either the Cleft team hasn't heard back from them, or they may not have been sent the forms. So there is yet to be confirmed. So it's really important that we try and work out how we can get that remaining percentage. So when we have consent to collect the outcome data, these are the sort of bits of information that we will be able to get from Cleft services. So they can tell us about the gestational age, so how many weeks they were when they were born, the weight they were at birth, and if there's any additional conditions such as syndromes or things like Raban sequence. We can find out at age 1 again about child growth. So when we say child growth, we're usually meaning height and weight data. At age 5, we collect quite a few different elements. So that's our biggest year currently for collecting data. So child growth data, dental health. So that's if there's decayed or missing or filled teeth. Facial growth, which we get as a 5-year index score. So that's looking at the position of the teeth and the jaws. We get speech outcome data and psychological health data. And then at age 10, we have some bits of data coming through about dental and speech outcome. So the purpose of collecting audit data is to improve the quality and equity of the care between the services. If we do see that a Cleft service is consistently achieving above average outcomes, then we can share learning from those Cleft services, and we currently do that in a format through webinars that we hold annually. We present that data in our CRANE annual and parent reports. And we also present at key stakeholder meetings, such as the SEND meeting groups and the Cleft and Craniofacial Conference that's held once a year. So the sort of information that you can see if you want to have a look at the audit data, we try and give a percentage of children that achieve that outcome, or for instance, for child growth, that's the percentage of children that have a healthy body mass index. So that's a really important way of detecting how children are doing compared to their peers, basically at those time points. So that for this time point, we're looking at children at age 5 for all of these that I'm going to show you. For dental health, 62% of children had no decayed, missing or filled teeth, which does mean that 38% did, which is quite high compared to the general population. But we do know that children with a cleft do have difficulties and are more prone to getting tooth decay. And finding out that percentage is really useful because we can then justify why research studies might need to take place. So there are several research studies at the moment looking in greater depth at child health related to dental health, and why those children might be more prone to getting decayed, missing or filled teeth. In terms of facial growth, 45% of children, this is children born with a unilateral cleft lip and palate only. This is not all children. They are the group that are assessed only, and that's because research had been done in that group. So that rate is better compared to the rate we published last year, which was 38%. But it's not to say that the remainder of those children that got a fair or poor score don't go on to have good facial growth at a different time point. And there is research to suggest that these early outcomes aren't predictive of later outcomes. For speech outcome, we found 60% of children had speech comparable to their non-cleft peers at age 5. And we found that children with a cleft of the palate only, compared to those with a cleft of the palate and lip, tended to have better speech outcomes. And within Crane, we have been looking into why that might be and doing development work around that. And hopefully that will also lead on to some future studies. Finally, in terms of psychological screening, 84% of children had scores in the low or normal range, which compares to around 90% of their non-cleft peers. And importantly, 93% of those families were screened before age 6. So they are being seen by a psychologist if they need that support. So hopefully some of you will have seen that if you consent, you can also consent to data linkage. There's 3 little boxes, kind of an overall one, and then the 3 below it that you'll see on the form. And this is a really amazing way of getting additional resources and different outcome measures that are kind of beyond those of the healthcare system. So we can link with things like the National Pupil Database, and that will provide educational outcomes. I can show you on the next slide. But we can also find data that would be an extra burden for clinical teams to collect. So things like hospital episode statistics record when a child has an operation, it gives a code for what that operation was, how long they were in hospital, and also if there's additional conditions that might not have been reported to Crane by clinical teams, because sometimes diagnoses happen kind of under a paediatrician or a member that might not know to send that information to the Cleft team. So if you have consented to that, then we can look at these different bits of information. And this has been particularly important for some of our development work. So I've mentioned the ones to do with hospital episode statistics. For the education data, we can also look at support children get in schools and if that might vary around the country or within regions. We've also recently obtained the newborn hearing screening programme data and been able to link for a specific project looking at that. We can see if hearing loss has been detected early on and if hearing aids have been provided. And also we can link to the ONS, which to see if a child has sadly died. So all of this allows us to provide up-to-date and accurate reporting and to create new or amend existing variables. It also allows us to look at the impact of clinical outcomes such as speech on a wider range of outcomes such as education, which is something that I'm particularly interested in at the moment. And as I've mentioned, it reduces the data collection burden massively for families and clinical teams, because we don't need to keep re-asking for that information or for clinical teams to put that on when they don't necessarily have additional time in their job plans to do that. And hopefully people have seen some of our conference presentations or seen publications, and we have sections on our website with those on. So in our last report, Kate had looked into case ascertainment. So this was a really important exercise to link to the ONS and hospital episode statistics to find out if we were collecting the correct number of children born each year with a cleft. So comparing our database to HERS to make sure we are picking up every child and they're being reported accurately to us. And then we can give you an overall prevalence of cleft lip and or palate in England. And that equated to roughly 1 baby in every 660 births that had a cleft. Last year, I started work with the newborn hearing screening programme data, and we were able to see that 3 out of 4 children with a cleft had a clear response in both ears on their newborn hearing screen. And this year we hope to present data on what their first audiology appointment showed. So it's really fantastic the amount of data that we can get from these linkage exercises. And we can also go on to explore other outcomes that we collect. So for instance, hearing and speech are thought to be kind of very heavily linked. So we could look at whether these outcomes early on could actually influence speech at a time point like age 5. And we can also go on further to look and see if those things influence education further down the line. So in summary, we use your data to improve the care of all children born with a cleft lip and or palate. And we're massively grateful to all of you for consenting to do that. If any of you are interested in the full reports, you can get that via our website. The snapshots that I've shown you today are from the patient and carer report, which is written with layperson language. So hopefully it's easy to understand, although if there are things in there that you don't think are easy to understand, we'd really love to hear from you. The full report is aimed at health professionals, so the language might be a bit more complex within that. And there are supplementary tables available for that with a lot of data within them. So it depends on the type of person you are, but all of those are available to you if you want to explore them on our website. The sort of publications we have produced, so in the recent years, we've looked at maxillary growth, so the growth of the jaw, and speech outcomes. We've looked at smoking and the incidence of cleft. The range and frequency, so number of additional congenital malformations that children with a cleft might be born with. We've looked at patient characteristics that affect speech outcome. So these are things that might be before a child has even had surgery. We can see which ones might affect speech outcome. And we've looked at educational attainment and how children with a cleft differ from their non-cleft peers. I would love to thank the people that contributed to the consent forms and the patient and carer report this year. We really appreciate the feedback they give, and we hope we managed to include all of the points to make it better for you. If you do go away after this presentation and have a look, if you've not seen them before, you can also email us at that web address there. Please let us know your feedback because we write it for you. So it's really important if you think there's something that needs to be different. And we're on to the questions. So these are the pre-seminar questions that we've received. So I'm going to let Kate have a little go at answering a couple of these, if that's okay.
Hi, thank you, Sophie. Can you hear me okay?
Yeah.
Yeah, good. Yeah, so we were given sight of these questions that were submitted ahead of this event. And so I'll take the first one. Has there been an obvious trend in the data changing over the years, i.e. more or less children born with a cleft or more or less of a certain cleft type? So if Sophie go on to the next slide and I can just talk through this. So using the CRANE database, we've looked at the number of children born each year with a cleft in England and Wales between 2011 and 2022. So over 12 years. And this graph shows birth years across the bottom on the x-axis. And if you just look at the right hand vertical y-axis, which says cleft cases, and this is represented by the blue line on the chart, and it shows you the number of cleft cases registered on CRANE each birth year. And you can see that there has been a steady decline. So it peaked in around 2012 when there were over 1,100 children born alive with a cleft in England and Wales. But since 2019, numbers have declined and they've been below 900 cases per year. But actually, if you look at the live birth rate in England and Wales, you can see that it's tracking alongside the number of cases. So the live births are represented by the left-hand y-axis and the orange line on that chart. And you can see that the number of cleft cases is relative to the total number of live births in England and Wales. So really to examine whether the rate of cleft effective births has stayed the same or changed over time, we need to look at them as a proportion of all live births. So if we go on to the next slide. So this shows cleft incidence rates over time in England and Wales. And the top line, so we've got, again, birth years across the bottom. And the top line shows all clefts, which ranged from around 16 per 10,000 live births in 2013. So that's when it peaked. And then it's gone to around 14 or below 14 per 10,000 live births in recent years. So we're looking at around a difference of 2 per 10,000 live births across the last 12 years where we have access to data. The lines at the bottom of the chart represent individual cleft types. So the top of the blue lines represents cleft palate, and as Sophie mentioned earlier, that's the most common type of cleft. And then we have cleft lip below that. So cleft palate, it's around 6 per 10,000 live births are born with the cleft palate alone. And then for cleft lip, it's around 3.5 per 10,000 live births. And then we've got unilateral cleft lip and palate, which overall affects 3 in 10,000 live births. And then we've got bilateral cleft lip and palate, which affects around 1.3 per 10,000 live births. And you can see really that those lines have remained unchanged or pretty stable over the years. So I hope that answers the question that was posted by one of the members ahead of this event.
Now, I'm not sure if I'm going to be able to go backwards. Is that going backwards? Yes.
Yes.
So we can see number 2.
Yeah.
So
So does Crane plan to carry on collecting the same data in the future, or are there any plans to collect more or different information? So as Sophie mentioned earlier, we have the Cleft Development Group, and they really oversee the Crane database. And we also have really good links with the Clinical Excellence network groups. So they represent different specialties that are involved in the care of children with a cleft. And they really inform us about what data items are really important and relevant for us to collect. And ideally, over time, we would have consistency in the data items we're collecting so we can assess trends over time, and we can look at differences between cleft units. But sometimes the clinical excellence networks might come to us and say, actually, this data item isn't really helping us anymore, and there might be something else which has improved that has come into play, and that might give us extra information. And at the moment, for example, we're working with the psychology group, and they've just asked us to drop one of the data items, and they're currently considering something new for us to collect. So some things do change, but lots of things we've collected for a lot of years as well. And we're also hoping to add data items related to ENT and audiology outcomes. So we're in talks with those groups at the moment as well. I don't know if you want to add anything, Sophie, to that.
no, I think you've covered it there. Yeah.
And will Crane be collecting data about adults specifically at any point in the future? At the moment, I think that's beyond Crane's remit. We currently collect data up to 10 years of age. As I said, we're talking with the psychology group, and the data items that they're thinking about asking us to add would be collected, I think, around 15 years. So we are extending it a bit, but at the moment, I can't see us collecting data on adults. And then another data, sorry, I saw another question come up in the chat. Sophie, you may be best placed to answer this with your clinical background, but why are cleft babies more likely to have tooth decay?
Well, I guess that's why research studies are being done at the moment. I know the Cleft Collective have quite a big research study to do with dental health outcomes, and here at Crane, Gibby also has some work ongoing to do with dental outcomes, and linked to things like ethnicity or socioeconomic status. But there are things like the connection between, if a child has a cleft palate, for instance, or a gap in the gum, the connection between the mouth and the nose that's not normally there is thought to play a part in that. Or it could be that a child has had a repair but might have a fistula, and it might be that there's different flora and fauna between the nose and the mouth that could be affecting decay. It could be that some children become particularly sensitive to toothbrushing, or might feel sore around their cleft following operations. It could be that their diets are different, and people are having more sugary foods than others. So it's really multiple factors, which is why the research needs to be done. And I think it's probably key organisations like the Cleft Collective that will be able to help answer those questions with a lot of patient questionnaire data and some of the different data points that we don't collect as part of Crane. But hopefully between the two groups, it'll be possible to answer some of those questions.
Thanks. And I understand someone asked about research opportunities or opportunities to become involved with Crane. Sophie, I know you've had sessions with parents, haven't you, to try and help us with our literature that we put out there.
Yeah, so there are different research opportunities in the sense that I've got a research opportunity at the moment by being part of Crane. I've got a funded job with Crane, which is thanks to Cleft Bridging the Gap. So I'm looking at a particular project, working with the team at Crane to try and answer a question about the newborn hearing screening data and speech. So there are funded opportunities in that sense. There isn't the opportunity to just come in at the moment and ask for the data because there aren't enough members of the team to be able to help answer those sorts of questions. The work of the audit is kind of the core function of Crane to produce those key outputs. And that takes up pretty much all of the time of the staff that are currently working with Crane. So we have had the opportunity to collaborate on studies, and that's worked well. So we've been able to collaborate with the Cleft Collective. We've also been able to collaborate with other health professionals on particular projects. And that's involved a combination of us kind of producing the data and conducting the analysis, and then the clinicians providing the context to that and helping write the manuscripts. In terms of how patients and parents can potentially help, I've got a couple of questions at the end. I'll just show you that I think there is potential for us to kind of hear your voice and for you to feedback which areas you think we could prioritize in terms of our development work. So we have all of this outcome data. Are there particular aspects that you would like us to look at? And we're hoping to kind of work a bit more with CLAPA to get feedback on things like that. But you can also contact us directly. I know not everyone has an extended role within CLAPA's groups that come to the PPI meetings. So I think if you have an idea and would like to email that, then that's also useful to us. Those other questions are just food for thought. I don't think we plan to cover them because I know, Antonia, you want to get through more questions. But if you do have any ideas around kind of consent and how we can access the maximum amount of people, or if you know that there's particular things about Crane that are putting people off from consenting, then do get in touch. And these are our details at the end so that you're able to do that. I think that's it.
Fantastic. Well, thank you so much, Sophie and Kate. It was really interesting, both for myself and I know that people listening and watching over on Facebook have felt the same. The lady who asked the question earlier about the dental cavity, she was saying thank you as well for answering her question. So we do have a little bit of time. If anyone does have any questions that they would like to ask, then do feel free to pop them over to us on Facebook chat. And then perhaps, Sophie, if you're happy, just go back to that slide with the questions on as well. Sorry, with the questions that you would like to ask the community. Just one slide back, that one, yeah. So again, if anyone did have any thoughts on any of these points that they wanted to write in the Facebook chat, then it'd be lovely to hear your thoughts on those. Either if we have time, we'll just briefly read them out this evening, or if not, then we can refer back to them and we can pass messages on to Sophie and Kate. And I think, Sophie, you kindly did share an email address, didn't you, where people could also send their thoughts to you. Is that all right to get that email address up on the screen just for there we go. So yeah, crane at rcseng.ac.uk. Or I'm sure you can find contact information if you just go to the Crane website as well. Fantastic. Well, thank you so much. If you're happy to stop sharing the presentation then, and we can oh, lovely. Excellent. I can see your faces.
Sorry, I'm so dark. I can't reach my light. I'm right in front of a window.
No worries. Looks very mysterious.
I am still
Oh,
here.
thank you so much to Sophie and Katie. I'll go through some final bits and just to let people know where they can find this information. Whilst we just wait to see if any other questions or messages come through on Facebook. Again, a huge thank you to you both for taking the time out of your evenings this evening. If you would like to provide us with any feedback, sorry, not Sophie and Katie, but for those watching on Facebook, if you would like to provide us with any feedback, then we will follow up on the Facebook chat, and we'll post something to the groups tomorrow to link to a feedback form that you can fill in, and we just really appreciate being able to hear your thoughts on how we can continue to develop these live Q&As that we do. If there are any other topics that you would like us to cover in the future, or any other different sort of formats or styles you'd like us to look at. So we're always grateful to have your feedback on that. And lastly, just some very important thank yous. So again, just wanted to mention that these events are funded by the National Lottery Community Fund and Smile Train. So a big thank you to our funders for being able to allow this to happen. A huge thank you to Crane for working with us this evening and sharing all this information, and especially to Sophie and Kate for your time this evening. Okay,
and
so
thanks to you, of course, for hosting us,
Okay.
Antonia,
Yeah,
especially at last minute.
My absolute pleasure. And once again, apologies for the technical hitches at the beginning. The technology would it always likes to keep us on our toes. I believe that's probably it because nothing's come through on the chat. But if anyone does have any other questions or comments that they'd like to leave, you'll be able to watch this video back. It'll be live on Facebook sort of instantly, straight after we finish up this evening. You can watch it at any time. And we'll also be putting a video up on YouTube, a recording of this within the next few days that'll have subtitles or captions that people can watch and get in touch with either CLAPA or with Crane with any thoughts or questions. And I believe that is about it from us. And we hope you enjoyed the Q&A. And we will hopefully see you again at one of our further online events, whether it be a live Q&A. Do check out clapper.com/events, and you can find out all the other things that we've got going on. From all of us, good night and have a lovely rest of the week. Thank you, everybody.
Thank you.
Bye, everyone.